I'm Dr. Balgopal Karmacharya. I'm a consultant neurosurgeon and an associate professor. I work in Manipal Teaching Hospital, Pokhara. So this city is around 200 kilometers west of Kathmandu, the capital of Nepal. And I've been working there for the last 13 years in the medical college.
Oh, 13 years. Well, it has been really a long time. And so I prepared several questions for you.
Yeah.
The first one is that how do you think of the future of UBE technique? Because I've heard that some people do say that UBE technique, it is a supplement of monoportal technique, and some people would say that UBE technique, it is the replacement of monoportal technique. So how do you think of this idea?
Yeah, okay, so I was a microscopic surgeon. So initially I learned monoportal spine surgery. I used to do transforaminal surgery. So recently I've been doing the biportal UBE surgery. So there are certain limitations of the uniportal surgery that you can overcome with the biportal surgery. So it is a replacement, but also there are the separate indications for both the surgical techniques. I think, but the indications for biportal are wider compared to the monoportal surgery.
Okay, thank you. Though UBE technique, UBE procedure can cover more than 90% of the pathologies, but I think uniportal, it still stands in some areas maybe. Okay, thank you. And we know that this conference, it is the first UBE international conference in Nepal. So would you like to say something to this conference?
Yes, so actually me and Dr. Nikunj, we're thinking of doing this conference a long time back, and we were in discussion with Mr. Dipankar, who is the bones representative in the Southeast Asia. So actually we were the people who introduced bones in Nepal. So we used to ask for the rent out the machine, and used to buy the probe, and then so they used to provide the bones machine, RF machine, to carry out the surgeries. So for the places who have not bought their RF machine themselves, they are still doing that. So actually they are helping us in introducing and disseminating the UBE surgery in Nepal, and I'm quite so happy that we were able to do this conference with the help of Bones. So they have brought the world-renowned faculties from India and China to this place, and we hope that our partnership will continue in the future as well. So as you said, this is the first UBE Con, but definitely it's not going to be the last. So we are planning to hold at least one UBE Con every year, so that more and more spine surgeons can take up this new technique, so that ultimately the patients will benefit.
Thank you, and thank you for your efforts to this conference. And also thanks to you and your colleagues and all the UBE surgeons so that our bones medicals machines and probes can function as it was designed. Okay, and also I also look forward to more and more conferences in Nepal. Okay, thank you.
Thank you so much.
Thank you for your time.